Assalamualaikum and good morning everyone. My name is FIKRI. Together with my group mate Zul Zafarani and SITI ZULAIKHA, we will present about the National Cancer Institution in Malaysia. Assalamualaikum, my name is FIKRI. Today we're going to present about the National Cancer Institute in Malaysia. Now let's begin with the background of the institute. The construction project of the National Cancer Institute is a long-awaited project and is the government's social responsibility to provide world-class healthcare in fulfilling the aspiration of the 2020 toward making Malaysia a developed country. The National Cancer Institute is a cancer medical institution specially built to provide specialized facility in treatment and medicine for cancer patients. The establishment of the National Cancer Institute is aimed to addressing all the growing need related to cancer issue in the country under the auspices of former Prime Minister Tun Abdullah Haji Ahmad Badawi. Now we move to the mission and vision of the National Cancer Institute of Malaysia. The mission is to provide the best cancer treatment service for cancer patients, to be a center for learning and training of expertise in cancer management and treatment for various categories of health personnel, including scientists and paramedics, to be the center and leader in cancer research in Malaysia, covering aspects of treatment and care of cancer patients in collaboration with other agencies from within and outside the country. The vision is to be a leading leader in cancer treatment management, education and research toward improving the quality of life of cancer patients and cancer survivors. Now we continue. The National Cancer Institute was handed over the Ministry of Health Malaysia on 18 September in 2013 at a project handover ceremony, and it begins operation on 2 September 2013. The National Cancer Institute is a hospital built with state-of-art equipment and information technology, cover diagnostic and specific treatment aspect in dealing with various cancer. And the last but not least is the main service provide. The main service provide at the National Cancer Institute are radiography and oncology, nuclear medicines, oncology surgery and palliative care. Other service provided are specialist clinic service, inpatient service, daycare service and clinical support service. The National Cancer Institute will be a leading center of excellence in cancer treatment, research and education and health service in Malaysia.
The Clinical Research Centre CRC network is one of the 6 research institutions under the National Institute of Health. The headquarters of the CRC network, the National Clinical Research Centre (NCRC), is located at the Kuala Lumpur Hospital. The purpose of the CRC was established is to carry out the task of coordinating research activities in National Cancer Institute. CRC also provides training and consulting service to support and promote research by establishing ethical principles to ensure the safety and well-being of patients. Malaysia has also been recognized as a health and medical tourism destination for 3 consecutive years by the International Journal of Health Tourism report from 2015 to 2017. In addition, International Living magazine also recognized Malaysia as one of the top 5 countries in the world in healthcare. Next is facilities at National Cancer Institute. Its strategic location is located next to Putrajaya Hospital, Putrajaya Central, fire headquarters, police headquarters, trade center, and it is easily accessible through the Putrajaya Ring and Lebuh Sentosa. This can make it easier for the patient family members to find a temporary place to live and in turn make it easier for them to find necessities while there. And the last one is National Cancer Institute has high technology and expertise. For example, user of nuclear technology for cancer medicine, it is used for the purpose of cancer imaging. This will speed up the process of cancer detection so that it can be addressed at an immediate rate. The cost of treatment is cheap compared to other countries. For example, for Malaysian citizens who receive treatment for the first time is free, and for foreigner as much as RM120, and for those who hold a United Nations High Commissioner for Refugees UNHCR card will receive a deduction of 15% of the charge imposed of foreigner. However, payment rates vary according to the type of treatment. Second, financial assistance to citizens. This can be obtained from the medical social work unit at the hospital that treat patient. If the patient is a civil servant, free treatment is provided and will not be charged any fees such as the officer's families, children under the age of 18, or if still in school under 20 years old. Therefore, many benefits are offered to Malaysian citizens and also to tourists from abroad who come to seek treatment in this country indirectly make the National Cancer Institute as their main choice.
Alright, shall we continue? Okay, my name is Zul Zafarani Bin Zulikafli, and I would like to present my part, and my part is analysis of Trang Institute Cancer National Malaysia. Cancer is the second highest cause of death in the world and in Malaysia in 2018. It contributes to 9.6 million deaths in the world and 16,000 deaths in Malaysia. Due to the high number of the deaths due to cancer, the latest information on the burden of cancer in the population is needed in determining the trend of the disease in Malaysia. To this end, the National Cancer Institute has published a second 5-year report, Malaysia National Cancer Registry Report 2012 to 2016, which is a continuation of the first MNCRR 2007 to 2011 report published in 2016. The main purpose of publishing this report is to see cancer incidence and burden trends in Malaysia for a period of 10 years from 2007 to 2016. See. And the latest report shows that there is an increase in the number of new cases detected in the period 2012 to 2016, which is 115,238 cases compared to 103,507 cases for the period 2007 to 2011, with an incidence rate H standardized incidence rate of 86 cases per 100,000 male population and 102 cases per 100,000 female population. For the period 2012 to 2016, the top 10 types of cancer detected among Malaysians in order of priority. Breast cancer is more to being a female or human has many female and human can get breast cancer, maybe from a great mother for a great father. So is a very mostly human and female can get cancer breast, but male can get, but is very suddenly. Collateral, lung, lymphoma like is like rock in the skin. Nasopharynx, leukemia, prostate gland, liver, cervix, and ovary. And this data in up. And subsequent analysis by gender found the highest cancer among men was colorectal cancer, followed by lung and prostate gland cancer, while the highest among human is breast cancer, followed by colorectal and cervical cancer. The most common cancers detected in children aged 0 to 14 years are leukemia and cancer of the spinal nervous system, while among adolescents aged 15 to 24 years is lymphoma. By example, if we, a man or male, doesn't want to be a cancer prostate, we can more to expose like a doctor said, we can masturbate when maybe we is like disgusting, but is like many doctor and doctor academic say is masturbate can be low to men can get prostate cancer. Okay, and the next. Okay, we continue the part. The incidence rate of cervical cancer has decreased significantly from 8 cases to 6 cases per 100 female population in Malaysia. This decline is likely due to an early detection campaign through government-provided pap smear tests at all health facilities. However, there has been a significant increase in the incidence seen for breast and colorectal cancer. Can get top in the chart. And then analysis by ethnicity showed that the Chinese were most often diagnosed with cancer, followed by the Malays and Indians. For every 100,000 Chinese population, there are 106 men and 117 humans with cancer. Among the Malays, males and females show an incidence rate of 74 cases and 91 cases per 100 population respectively. And for Indians, the recorded incidence rate is 67 male cases and 107 female cases per 100,000 population. However, female cases per 100,000 population compared to first report, there was a decrease in the incidence rates among the Chinese and Indians, while an increase in the incidence rates was seen among the Malays. Okay, the next part. Okay. In addition, cases detected late at levels 3 and 4 were found to increase from 58.7% in 2007 to 2011 to 63.7% in 2012 to 2016. This finding is worrying because the Malaysian study on cancer survival, which was published in October 2018, showing the later the cancer is detected, the lower the patient survival rate. Therefore, multi-stakeholder cooperation is needed in identifying areas for improvement to increase community awareness and access to early detection and treatment. And lastly, and overall, it can be concluded that this latest report shows an increase in the burden of cancer among the Malaysian population. This information should be utilized by all stakeholders in the planning and evaluation of the effectiveness of cancer control and prevention programs. And that's all from me. And it might be boring, but is the facts to the facts. What can I say? Is all the facts. Okay. Thank you.